In the last section of our topic, burn wound infections, now let's discuss about some treatment options. In this, we will talk about the antimicrobial agents that can be used for the burn wound infections, also mupirocin and topical therapy, and sub-ascarclysis and tetanus immunization after the burn injuries. The ultimate goal of the burn wound management is closure and healing of the wound. So that's the picture in which there is the burn wound in the later stage is pretty much healed burn wound. So the ultimate goal of burn wound is closure and healing of the wound. Early surgical excision of the burn tissue, extensive debridement of necrotic tissue. Daily debridement or the alternate debridement in the initial stages, maybe twice a day or 3 times a day debridement of the burn wound is very, very important to reduce the incidence of the infection. If the wound is not debrided or dead tissue is not removed, then there is more possibility that there is accumulation of bacteria under the eschar or the dead tissue that slowly cause multiplication and division and cause cellulitis or sepsis. So excision of the burn wound and daily debridement is very, very initial management of the wound, and usually the burn wound they left open with the topical ointments and some dressings, and then it is covered on top to avoid any flies and different things to protect against the infections that can access the person. So exposure is avoided, but usually the wound is not dressed. It leaves open with just a thin dressing on top. Grafting of skin or skin substitute is done. So these are the excision of the burn wound, debridement, and then the grafting. Some antimicrobial agents that can be used. We have topical antimicrobial agents like silver sulfadiazine cream, mefenide acetate cream, silver nitrate cream, and nanocrystalline silver dressing. So all these are the topical antimicrobial drugs or agents that can be tried after the debridement put on the burn area. Silver sulfadiazine cream, mefenide acetate cream, silver nitrate cream, and nanocrystalline silver dressing. They decrease the bacterial burden of burn wounds, reduce incidence of burn wound infection, and they apply to partial and full thickness burns. Active against many bacteria and some fungi and are useful before bacterial colonization is established. Mefenide acetate, broader activity against gram-negative bacteria. Silver sulfadiazine, it is often used initially. Value limited by bacterial resistance, poor wound penetration, and toxicity, which can lead to leukopenia. So silver sulfadiazine is used, but it is limited, has limited value because of bacteria develop resistance against silver sulfadiazine and it penetrates the wound poorly. It also cause toxicity leading to leukopenia or decreased in the white blood cells. Disadvantages of mefenide acetate: it inhibits carbonic anhydrase, leads to metabolic acidosis. Then we have nanocrystalline silver dressings, broader antimicrobial coverage, moderate ability to penetrate eschars, limited toxicity, exhibiting activity against methicillin-resistant Staphylococcus aureus, vancomycin-resistant enterococci. So it has more effectiveness against methicillin resistance, Staphylococcus aureus, and also vancomycin-resistant enterococci. Then we have mupirocin. Mupirocin is topical antimicrobial agent. Eradicate nasal colonization with methicillin-resistant Staphylococcus aureus. Used in burn units where methicillin-resistant Staphylococcus aureus is prevalent. Efficacy comparable to that of silver sulfadiazine, reduces burn wound bacterial counts and helps in preventing systemic infections. Then topical therapy: when superficial fungal infection occurs, nystatin may be mixed with silver sulfadiazine or mefenide acetate as topical therapy. So when fungal infection occurs superficially, nystatin can be combined. Nystatin is used against fungal infections. Moisture retention ointments promote rapid autolysis, debridement, moist healing of partial thickness wounds. Subeschar clysis, subeschar below the eschar tissue, direct instillation of an antibiotic, often piperacillin, into wound tissue under the eschar. So direct instillation of the medicine below the eschar tissue of the burn. Useful to surgical and systemic antimicrobial therapy. Systemic treatment with antibiotics. So this can be tried as instead of surgical and systemic antibiotic therapy and systemic treatment with antibiotics. Penicillin allergic patients, how we can treat them: vancomycin substituted for oxacillin is efficacious against methicillin-resistant Staphylococcus aureus. Ciprofloxacin substituted for meslocillin. So patients who are allergic to penicillin, we can try vancomycin and ciprofloxacin. Oxazolidinone antibiotics like linezolid, efficacy in reducing bacterial growth. Tetanus immunization, booster immunization of the tetanus is given only in patients if they have complete primary immunization, they do not receive booster dose. Patient without prior immunization should receive tetanus immune globulin and undergo primary immunization. So patients who are immunized before with the primary immunization should get a booster dose if they don't have the booster dose received, and those who do not have immunization before should receive tetanus immunoglobulin, and then they should receive receive the primary immunization series. So this was the tetanus immunization. Then the treatment is strict infection control practices, appropriate antimicrobial therapy, prophylactic systemic antibiotic, oral antibiotic for selective digestive decontamination, and strategies to reduce or limit systemic spread of wound infection. So these are all the treatments. It's strict infection control practices are very important. Appropriate antimicrobial therapy, prophylactic systemic antibiotics, all these measures are performed to reduce the risk of infection, and if infection occurs, to reduce the likelihood of cellulitis and septicemia. So that concludes our topic of burn wound infections, in which we covered in detail all the aspects of the burn wound infection and how we can diagnose and manage them. Thank you for watching sqadia.com.